Welcome back to Morning Extra. A Connecticut study has just made international news. A local doctor has found that some kids who use baby wipes can develop itchy, scaly, red rashes. But before the study, there weren't any reports about allergic reactions to the wipes. This morning, to tell us more about what this all means, I'm joined by Dr. Wu Chang and a local mom, Liz Norman, whose daughter who was highlighted in Dr. Chang's studies. Ladies, thank you so much for being with us.
Thank you.
Good morning. Thanks for having us.
Now, we're going to talk about the study, but first we want to basically talk about how the study got started. Liz, your daughter developed a rash, and you brought her to see Dr. Chang. Before that, you had never seen it before, right?
Right. That's right, Erica. Liz brought our daughter to see me for a mystery rash that kept recurring on her face and on her bottom. And her pediatrician kept treating it with different treatments, oral medications, topical medications. It would get better, and then it would come right back. And it was very painful and itchy.
Nobody knew what this rash was. It was kind of like one of those mysteries, right, that you see on TV.
That's right. And it was puzzling to me at first, too, because it kept coming back. So finally, I thought to ask about what products was Mother using. And finally, do you use wipes on her? The little girl was out of diapers. There was no reason for her to really be on baby wipes, but I just kind of thought to ask.
But they're handy, you know.
They are.
Moms use them at any age. So then what happened?
So we decided to stop the wipes, just use plain water, and sure enough, the rash got better. And so I decided to do some patch testing to determine what chemical it was in the wipes that was causing the rash, and that's when the preservative really lit up like a bright light on her back for the patch testing, and so we knew.
And so what is the chemical that her daughter had the reaction to?
It's called methyl isothiazolinone.
But it does have a nickname, right?
The nickname is MI.
MI. Okay, well that's helpful, certainly. And then so once sort of Dr. Chang pinpointed what it was and we stopped the wipes, did you see a dramatic change?
Oh, absolutely. The rash cleared up very quickly with the stopping of the wipes.
So doctor, what do moms and dads need to look out for?
I think
Is this something that every child could be at risk for? Or, you know, how do we know who is more susceptible to having this happen to them?
That's a good question. I think parents do need to be aware that wipes can cause allergic rashes. So if there's a rash that's not going away the way it should, we should think about what products we're using and is the wipes part of the problem. People more at risk are individuals with existing rashes, breakdown in the skin area, and this can be adults as well as children. Any age group can actually develop this allergy.
Now, are there any wipes out there that you know of that don't have this chemical in them?
There are, but people have to read labels.
Right. Yeah, it is so important these days. Now, as a mom, I have to imagine it must have been really frustrating for you. Your daughter, Hannah, kept getting the rash. We saw a picture of it, you know, as a mom, you know, your heart, you know, you just cringe knowing that it's painful, it's awful.
Heartbreaking and frustrating to not be able to cure what is the problem.
And that's why I'm sure it's important for you to sort of get the word out there.
Oh,
now,
absolutely.
After going through it yourself.
Yes, don't be misled by hypoallergenic or sensitive. Definitely read the ingredients.
So what's the latest now with the study? Because you found other individuals who had reactions
after
similar.
we figured this out with her daughter, then I was more aware, and I began to see other patients. I was suspicious that the wipes were causing a problem. I learned to ask about the wipes, stop the wipes, and then patch tests, and 5 more children were proven to have this allergy in the wipes. But an additional probably 10 patients or even more have presented to my office that also I was very suspicious that it was the wipes. They cleared when the wipes were taken away.
And your study is now getting sort of national attention with your findings, right?
I'm really happy about that because I think parents are more aware, and also Kimberly-Clark, the manufacturer, has announced that they're removing methyl isothiazolinone.
Well, that's great news. Yeah.
So.
All right. Well, once again, the chemical to look out for on the labels.
It's a long name, methyl isothiazolinone. There are other preservatives too that can cause rashes, but this is the particular one.
That's the big one.
That's right.
All right. Well, we'll definitely have that information on our website. Ladies, thanks so much for being with us, and congratulations on your study.
Thank you very much.
And that Hannah is feeling so much better these days.
Much better.